Hello everyone, welcome to the program Medical Nutrition Therapy with dietitian Michelle. It promises to be an exciting ride as we shall be discussing diet-related matters concerning your health. So stay tuned as we begin. On this particular show, we are going to be talking about all the things that you really need to know about MNT, and basically it's going to run from what you should know about MNT, that is medical nutrition therapy, what to expect during MNT, who should provide MNT, diet plan as an integral part of MNT. So these are the questions that we are going to be hovering over with our dietitian here in the studio. I'm talking about Michelle Umadi, who is an expert in this particular regard. So welcome to the studio once more.
Thank you, Spence.
All right. So what you should know about MNT is the first question that we are going to be asking, because a lot of people would be wondering what that means. And then I'll let her explain it, even though I know I've said it in the introduction of the show. So first off, Michelle, what is MNT?
All right, now the full meaning of MNT is medical nutrition therapy. And that simply means a nutrition-based treatment that is provided by registered dietitians. It's not just counseling, and it's not just issuing a diet plan, and it's not providing nutritional guidelines. It's a treatment plan. It's a treatment you have to implement, and you can measure and see results. So medical nutrition therapy is what we are talking about.
Okay, so a lot of people would be wondering, isn't this nutritional guidelines? The question that I'd be asking right now is, what is the difference between MNT and nutritional guidelines?
Yeah, just like you've mentioned, there are guidelines just to guide you, but that is not the treatment. For instance, in the management of diabetes, you will hear, cut down on your starch intake, reduce this, don't take refined foods, avoid sugar. Now, these are guidelines. It helps, but that is no treatment. If you follow the guidelines, how will you be able to measure your results? It's not possible. And if you're following the guidelines, what would you say? How much carbohydrates are you taking? You can't measure that. You can't estimate, because in the management of diabetes, basically the amount of carbohydrate consumed is measured, is regulated, because when you eat more than you should in diabetes management, even with your medications, your sugar level will not be controlled. And even if you eat less than you should eat, it causes what we call hypoglycemia, and that is also not management. So nutritional guideline is just a guide, something to keep one going before they get to see the dietitian, who will plan and structure their diet based on many factors to achieve results. So the guidelines, it's not what dietitians provide. We provide what is called medical nutrition therapy. And here now, it's specific. You're going to hit the nail on the head. You're going to mention what the plan is all about. Is it carbohydrate control in diabetes management? Is it protein moderation in kidney management? Is it calorie control in weight loss? So you're specific about your plan. It's a treatment. There is no assumption here. You're treating somebody with food. So you're specific about the plan. Then it is also measurable. When you follow this plan, you're going to see so and so results at the end of so and so. You see, we are measuring progress. For instance, again, if it's diabetes now, after 3 months, your glycated hemoglobin is supposed to come down by 1%. Glycated hemoglobin is actually what we use in our management. That is what we use to measure progress in diabetes management. So, for someone who comes in with a high glycated hemoglobin level, for let's say like 9%, you tell the person, when you follow this plan, I just placed you on 180 grams of carbohydrate based on many factors. When you follow this plan, combining it with your medication and some physical activities, your glycated hemoglobin will come down by 1% in 3 months. If it's kidney management, we are talking about creatinine and urea levels. And when you follow this renal diet that is calculated based on your body weight, then it's going to come down. Your creatinine and your urea will come down by so and so. If it's weight loss, I have placed you on 1,200 calories or 1,500 calories. When you combine that with this number of steps, 15,000 or 45 minutes of exercise, you will be able to lose 0.5 to 2 kg weekly. So you see the difference between medical nutrition therapy and nutritional guidelines. We are not just assuming, we are not hoping, we are not believing, we are strategically planning a solution, and we are guaranteed of results, something that is measurable. So we are specific in medical nutrition therapy, and our plans are measurable.
Interesting. So now that we've understood the difference between MNT and nutritional guidelines, what are the benefits of MNT?
Medical nutrition therapy is very important in the management of what we call diet-related diseases. And some of the benefits are, number one, it can help delay or even prevent development of complications. It should be an integral part of treatment of these diseases called diet-related diseases. That is a standard, that is a recommendation by WHO, by NICE, and many other health organizations. Now, when somebody has diabetes and the person is on a medication that is called metformin, studies have shown that this particular medication increases risk of developing a kidney problem. Now, we say it increases, not that it's automatic, not that someone who is on metformin must have a kidney problem. No, but there is a high risk, there's a high chance of that happening. So when medical nutrition therapy is in place, the dietitian knows that, okay, this person is taking metformin, this person is taking, or even insulin. Yes, these are some treatments that can cause that. What are some measures that you're going to put in place in your diet to reduce this risk? So we are putting that in perspective, and we are reducing some foods. Legumes are healthy foods. They are actually incorporated in the management of diabetes. It should be an essential part, but for someone who is on metformin or someone who is taking insulin, we reduce their intake. Instead of taking it as much as 5 or 6 times in a week, we bring it down to 3. Why? Because we are putting other things into perspective. Implementing medical nutrition therapy is not just going to prevent development of complications or even delay it. It's also flexible. It helps you understand the relationship between food and your health. It also helps you know what you can exchange. So it makes your life easy. You're not just I don't know how to put this now. You're not just being told eat this and not that. No, you know why you should eat what you are eating, and you know what it's going to do to you or help you achieve when you're trying to control a condition. I have some clients who tell me, look, dietitian Michelle, I like to eat this. Will you be able to factor that into my diet? And I will say, yes, I'll be able to factor that, but this is the amount you should eat. So you will know how to eat without overeating. So you see the flexibility that medical nutrition therapy comes in to play. Because you're able to calculate the diet, you're able to plan it. It makes your client's life very, very flexible. So the benefits, again, I'm going to say, number one is that it helps in the prevention and in the delay of complications. It also makes one's management very flexible, knowing the relationship between food and his or her health. It gives the person control. The client knows what to eat. The client knows how much to eat. The client knows when to eat. The client knows what to exchange in their diets even when they want to go off record. So it's flexible, and it helps to prevent or delay the development of complications.
Interesting. Stay with us. We go for a very short break and we'll be back. Did you know proper medical nutrition therapy provided by an experienced dietitian can help you control your sugar level, reduce your blood pressure, reduce high cholesterol, lose excess weight, treat cancer cells, restore kidney function, and gain weight if necessary? Do you struggle with any of the aforementioned? Then call to consult with dietitian Michelle on 0904 675 8079. Again, 0904 675 8079. Or visit our website at www.dietitianmichelle.com to learn more. Okay, so when should medical nutrition therapy be implemented? Could this be at diagnosis or after complications arise?
The recommendation is at diagnosis. Immediately one is diagnosed with a diet-related disease, the person needs to see a dietitian. Very, very important before complications arise. Now, that does not mean that medical nutrition therapy won't help when there are complications. It does help. It helps. I have seen a couple of people who had complications and they came out of it with proper medical nutrition therapy and, of course, their medication. But it does not have to get there. It's not when the problem becomes complicated, dietitians are invited. No, it's at the point of diagnosis. Immediately one is diagnosed with a disease that is diet-related, dietitians are brought in. They're supposed to start management at the same time the person is starting oral treatment. So it is not after complications, it's immediately. That is WHO standard. Medical nutrition therapy is core, is important, is key in the management of these diseases. So why wait for complications to arise before bringing in a dietitian? There is really no need. It's important they come in at the point of diagnosis to prevent or delay these complications from arising. When complications arise, the management is a lot more difficult. Now, for instance, someone who has just diabetes and medical nutrition therapy is implemented promptly, there's going to be a delay or prevention of those complications. But when the complications arise, like a kidney damage or hypertension, it makes the diet planning, it makes the diet calculations a lot more complicated. And so you're not just looking for foods that will control the sugar level. You're also looking for foods that will control sugar level. At the same time, looking for foods that will help blood pressure. You're also looking for foods that will not overwork the kidney. So it makes the food uninteresting. It becomes very difficult for the patient to even comply, because at this point, they're not just going to eat foods that are nutritious or foods that are tasty, that are delicious. It's now called therapeutic diet. Sometimes the food does not really taste nice. It doesn't taste very nice. Therapeutic diet. Why? Because the treatment has become complicated. There are many other issues. It's not just one goal you're looking at. You're looking at being able to help the person to achieve control for 3 different conditions. So it's important to bring medical nutrition therapy at the point of diagnosis.
Interesting. Okay, so when should MNT be implemented? At diagnosis or after complications arise? Because I know a lot of people would be interested in knowing this particular angle to the MNT approach. Who then needs MNT? Who needs medical nutritional therapy?
Anyone who is battling with what we call diet-related diseases. Now, these are diseases that diets contributed to their development. So, diets must be an integral part of management. I'll give you some examples. Diabetes, like I've been mentioning, is a diet-related disease. In diabetes management, the nutrient of concern here is carbohydrates, and that has to be regulated for control to be achieved. Diabetics should not eat less than 135 grams of carbohydrates. They should not eat more than 240 grams of carbohydrates. So this is a diet-related disease, so medical nutrition therapy must be part of treatment. Hypertension is a symptom also that requires and responds properly to medical nutrition therapy. You're going to be talking about cutting down or even calculating the amount of sodium the person is taking in, cutting down on the oil. So it responds very well to medical nutrition therapy. Then kidney conditions. These are also diet-related diseases and responds well to medical nutrition therapy. In kidney conditions here, the amount of protein is now based on the person's weight. Usually, it's supposed to be 0.8 to 1 gram per kg body weight. But in kidney conditions, sometimes we recommend taking less than the standard. And so the person might be placed on 0.6 gram or 0.7 or 0.8 per kg body weight in calculating the protein he or she should eat. And not just protein, there are some minerals that are also put into consideration in planning the diet for a kidney condition. Potassium is regulated, calcium, phosphorus, sodium. These are also regulated in a renal diet. Even cancer. Some or even most cancers are regarded as diet-related diseases that respond well to medical nutrition therapy. We're talking about cutting down on animal proteins, and looking at plant proteins. Obesity is also a diet-related disease. When someone is overweight, there needs to be a reduction in food intake, calorie intake, so the person can lose weight. Underweight is also a diet-related disease because immunity is very poor here, so you need to put on some weight so that your immunity can be strong. Some surgeries require medical nutrition therapy because excess fat can cause complications during surgery, so that can be used or it can be implemented for anyone going for surgery to lose some weight before going in for surgery. And even poor nutrition, loss of appetite, all these respond to medical nutrition therapy. I have not exhausted it all, but I think I'll leave it at this.
All right, listeners, thank you for listening. We go to our breakout segment with Naomi and take caller responses, and we'll be back. Don't touch the dial.
So, we're going to be taking a testimony from someone who has benefited from medical nutrition therapy. Good morning, Sarah. It's good to have you join us in the studio today.
Yeah, good morning. How are you?
I'm very fine, thank you. You're one of dietitian Michelle's clients.
Yes, that's correct.
Okay, so we'll just want you to give us a very brief story on how your journey has been.
Okay, well, all I can say is that since I started with her diet plan, there have been quite some improvements overall in my health.
Okay.
You see, everybody has a notion of what is good or not good to eat. It's purely personal notions, and they are not, in most cases, they don't conform in most cases to the practices. Because everybody knows what they don't know.
Yes.
The relationship it has, what it has with their body, they don't know.
Yes.
Hello, sir. Can you hear me, sir?
Hello, can you hear me?
Yes, we can. Well, we seem to be having some network challenges, but we'll still want you to go on.
But you hear me now?
Yes, it is.
Okay, so like I was saying, when I met her, there was this approach that was quite different from what I used to know.
Okay.
Giving me a list of what to eat and things like that. Avoid this, don't avoid that. But I think it was studied because it took into account the calories I should have a day, my weight and everything. And she came up with some plans.
Okay.
Because initially you don't like changing the food is quite good, so you like to eat what you love to eat. But after a while, and eating properly, you adjust to whatever she prescribed. And then it went on. After a while, I asked her, okay, you didn't put all the things I love to eat. So I named a lot of things I like to eat. I said, now you walk and tell me what quantities I should eat. It turned out very fine. I'm still on the diet today, and I've tried to advise a lot of my friends to go into well-studied diet plan. Extremely important.
Yes.
Okay, you were saying?
Okay, I was saying you're advising your friends to have...
I've lost you again.
Okay, so we lost our clients there due to network challenges, but I'm sure you have heard his testimony and how important medical nutrition therapy is. So that's about what we can take on today's episode of the MNT series. We do hope that you join us next time.
Interesting. Thank you so very much for those points. They are quite valid, and I'm sure a lot of our listeners would have understood what medical nutritional therapy is all about, and they would want to reach out for more information. Well, we've got ads that are running on this particular content, and I'm sure you're going to be getting all of the information relating to how you can reach her and also about the other product that she actually produces for your own benefit. So thank you so very much for listening on the show. Catch us next time on Medical Nutrition Therapy Series, and I'm sure you're going to be learning a whole lot more when we return. Stay safe, eat healthy, and be good. Dietitian Michelle is a registered dietitian in Nigeria, an expert with over 10 years in practice, a seasoned professional in diet calculation and planning. the co-founder of Citadel Nutrition Consult, author of several ebooks on weight loss and diabetes management, member of the British Dietetic Association, UK, member of the Nutrition Society of Nigeria, holder of certificate in diabetes care from the University of Warwick in the UK, holder certificate in exercise prescription for the prevention and treatment of disease, Trinity College, Dublin, holder certificate on nutrigenomics for professionals of nutrition. Thank you for tuning in to Medical Nutrition Therapy with Dietitian Michelle. If you have questions or comments about the topic discussed on this episode, you can find Dietitian Michelle on YouTube at Dietitian Michelle. Stay safe, stay healthy, and bye for now.